Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm Theodore Henry. The Ministry of Health and Wellness has strengthened its delivery of HIV treatment, care and prevention through a partnership with private healthcare provider Health Connect Jamaica, which we can abbreviate as HCJ. To speak more on the services being offered through this well-needed partnership is Director of Health Connect Jamaica, Dr. Geoffrey Barrow. Welcome to the program, Dr. Barrow.
Thank you for having me. Welcome.
All right, so let's talk about HCJ. Tell us about your company. How did it come to be?
Sure. So Health Connect Jamaica is actually an initiative out of the Faculty of Medical Sciences at the University of the West Indies.
Right.
We are funded by USAID to develop a intervention to address the barriers and gaps that the national HIV response was facing. Namely, those gaps are around the quantity of services that were being delivered for people living with HIV, the quality of those services, and we were tasked to do it rapidly and in a cost-effective manner. So 4 things we needed to address in quite a short space of time.
All right, so filling the barriers rapidly, cost-effective.
Absolutely.
What's the 4th? I feel like I'm missing one.
Quality.
Quality,
Absolutely.
Quality.
Yeah.
All right, so tell us about some of the services. How do you go about hitting these 4 things?
Sure. So what we've done is develop this network of partners and providers in the private sector. So we contract with doctors that already exist. So one of our clinicians that provide services might be your private doctor.
Right.
The labs, the pharmacies, and the psychologists are already existing in the private sector. And what we've done is co-opt them into our network of service providers to be able to leverage the existing structures, reduce the overhead costs, and to do it in a cost-effective manner.
So how do people get access to it?
So we act, Health Connect Jamaica, as the hub of this hub-and-spoke model of network. So what will happen is that we will get referrals from many places. So through somebody who might watch this show, they will contact the hub, and then we will distribute them from the hub throughout the network.
Ah, so it's almost like being that mail person at the middle. You get the information and you distribute as
Absolutely,
needed.
absolutely. So at the hub, we provide a lot of the sort of coordination services. So all the administration, the finance, the monitoring and evaluation, and we do have some clinical services. So if you were to compare a private sector office, it's just the doctor, right? But if you go to a public site, they have adherence counselor, social worker, and all the wraparound services that may be required for somebody living with HIV.
Right.
So we have case managers and contact investigators that work in-house, and what they do is they help the clients to navigate the system within the private sector to be able to access the labs, the pharmacies, and the doctor.
I'm pretty sure this does wonders for the centralizing of data.
So we actually utilize one of the Ministry of Health's electronic databases, and that's how we are able to seamlessly feed all of our data directly into the national system, supporting their ability to make decisions, to see what's happening in the field.
Sounds like people aren't getting lost anymore in the system.
So, people becoming or dropping out of care, they're never really lost. They've dropped out of care.
Yeah.
And they do that for a myriad of reasons. One of the main ones is sort of a competition of daily life, right? So if I have to make a decision between taking the time to go and see the doctor or finding food or housing my children, then those are some of the reasons why people drop out of the service. So what's important is to be able to identify who those persons are that need those additional support services so that they can then find the time to be able to see the clinicians.
You've spoken a great deal about quality without speaking about quality. Yeah. That interconnected nature of the service.
Yeah, so HIV and many infectious diseases, the quality of the outcome is absolutely critical for controlling the epidemic, right? So in terms of how we measure quality in a tangible way, it's really getting the person to what we call viral suppression. So it's having the medication reduce the amount of virus that's circulating in a person's bloodstream in order to make them non-infectious so they can actually not transmit the virus to somebody else.
Right.
So when you ramp up the quality of a service and you reduce the viral loads that's being in an individual or all of your individuals, then you control the epidemic because not as many new people are becoming infected.
You spoke about the network, and I'm looking at my notes here: 63 doctors, 4 laboratories, 41 collection sites. It sounds well distributed.
Yes, yeah, absolutely. So we have service points in all 4 health regions. We've only launched in July of 2020, so we're 2 years old. And so the rapid expansion is what we'd like to support. We do have some parishes, that especially northeast, that still need to be filled.
Right.
But we are rapidly expanding. I expect to get to over 100 doctors by the end of this fiscal period. We double in size in terms of our patient numbers every year, so 0 to 150 to 300 to 600 and on.
I think you've answered my next question already. I was going to ask you what the take-up was like. You know, you're seeing exponential growth.
Yeah, exponential growth. And what we want to do is to be able to continue the support not only from our funders through the President's Emergency Plan for AIDS Relief, through USAID, support from the University of the West Indies, but also the partnership with the Ministry of Health to be able to support that rapid expansion. So because we don't want to sacrifice the quality of the care,
right,
which can sometimes happen when you're rapidly expanding
True.
the size, we need to be able to bring on additional persons within the hub. And the hub is used loosely. So we have a team that actually works out of the University of the West Indies Northern Campus, as well as an office here in Kingston. So we'll need to be able to also expand the team to support that rapid expansion to make sure that the clients that are coming on board also experience the same quality that we've already been able to provide to the existing 600 people.
All right. I want us to go a bit more into how this all began, but we're going to do that on the other side of
Sure.
this break. This has been Get the Facts, or this is Get the Facts, and we're looking at the HCJ's partnership with the Ministry of Health and Wellness and the impact that is having on Jamaica land we love. Please don't go anywhere. The conversation continues on the other side of this break.
60 years! Well, 6 decades for Willica Island independent, and we have accomplished so many things. What do you think are some of our country's greatest achievements in the last 60 years? Think about it now and make we know by entering the JIS Heritage Photo Competition. If you're a tertiary level student, compose a photo under the theme Jamaica's greatest accomplishment since independence. Great prizes to be won. Visit jis.gov.jm for more information. Competition closes October 31. The JIS Heritage Photo Competition. Enter today.
Welcome back to Get the Facts. We are continuing our discussion with Dr. Geoffery Barrow of Health Connect Jamaica, who is telling us about the partnership that has been struck with the Ministry of Health and Wellness to provide even greater care. And I'm just going to put quality care for persons living with HIV on the island. Dr. Barrow, I want a bit of the history lesson. You mentioned that HCJ is 2 years old, and I'd like to know how HCJ and the Ministry of Health and Wellness got together.
Right. So as it is, it's only 2 years old. So at the beginning, so I've been involved in HIV care since 2007.
Right.
I've worked from the university hospital to the private sector, being a doctor. I actually acted as the director for treatment and care in the HIV program at the Ministry of Health. And so I had a clear understanding of where the gap was and what needed to happen in order to reach to epidemic control.
Right.
And so we engaged with the U.S. government, along with the Permanent Secretary in the Ministry of Health, Mr. Dunson Bryan, to really make a decision of how we're going to do this multi-sectoral response to HIV and how could we leverage the private sector to be able to respond to the needs and the challenges that the national program was having.
Yeah. I want to interject here. You mentioned multi-sectoral, and I'd like us to have a clear picture of the sectors that are involved in
Sure.
this care.
So for Health Connect Jamaica, we took great pains to ensure that we were not considered a separate vertical program or a competing intervention.
Right.
So we created a multi-sectoral team of our steering committee that was chaired by the Permanent Secretary, Mr. Bryan. And so in that way, we are not a competing separate vertical program. We are an integrated component that supports the action of the national response from the government of Jamaica.
So one stop. You know,
One stop.
This is where you go.
Yep.
Right. So you were telling me about how it came together a bit more.
Right. So once we understood, we did an analysis of what the epidemiological profile in Jamaica was, clearly showed quantity, quality were the two main areas that we needed, and how could we do that fast, and how could we do it cost effective.
Right.
And so what happened was that we pitched the idea at the National Strategic Planning meeting, also led by the Permanent Secretary. He was interested in the idea. We sought funding from the U.S. government in Washington in 2018, and then came back and started building the project. So 2019, we worked really hard. We developed the team, worked with the university and their support to start the network. We had some early adopters who were people that I knew were already treating patients with HIV. in Jamaica, who helped us to work through some of the kinks. And then in July 2020, we launched to the public.
And 2 years later.
2 years later,
Here
600 patients. Yeah.
I'm very curious about the different disciplines, because people think about HIV care, they simply think doctors and pills.
Sure.
But there's more involved, isn't there?
Yeah, absolutely. So HIV is really a social disease now, right? Chronic disease, but it's really a social disease. So what we need to be able to understand is that if you cannot support people who are have very significant social needs, to address those needs, the healthcare is always last on the list. One of the challenges with HIV is that you can remain well or healthy looking for about 10 to 15 years after your diagnosis. And so for 15 years, you're infectious. And you can be transmitting the virus to other people until you remain ill and go to the doctor. So if we don't have programs that intervene and screen and diagnose people early, even when they're not feeling unwell, then we're missing the boat. Right? So there's that component. And then when we do diagnose them, if we're not able to support them for all of those other social needs, the housing, the childcare, the food, the education, then we're not going to be able to have them on the medication consistently, which you need to be in order to suppress your virus and to be untransmittable.
The psychological as well?
100%. So that's why we not only have doctors in the private network, but we also have psychologists that work with us. And so they provide most of their services actually over the virtual platform. And that's how we have national coverage of mental health services through the network, through 6 or 7 psychologists.
So seriously, a full service network.
Yeah, so we understand that we have to be, but we recognize right away that we don't have to be the ones to provide all of them, right? So we leverage the existing structures that are already there. So for example, we work with the Ministry of Labour and Social Security around social access programs. So we're working really hard now to build out that component of social protection agencies, because we understand that there are gaps even when they come to Health Connect Jamaica. We're solving one problem, the initial problem, which is they never wanted to go to the public sector, right? So they can come to the private sector. We have a confidential reporting system where all of our clients can report how they feel about the service. Confidentiality, privacy, friendliness, and staff professionalism are the 3 reasons that pop up every single time. It's almost the whole pie chart of the reasons why people want to come to Health Connect Jamaica.
That is interesting. You haven't mentioned the actual medications and the capacity for testing.
Yeah, so all of the medications we get through the government as well. So the Ministry of Health either provides them and purchases them through their budget system, or they're supported by the Global Fund to purchase some of the ARVs, I think, still. And our patients are able to access those. So for a long time, the Ministry of Health and the government has had the foresight to understand that they should not be charging individuals, whether rich or poor, for access to HIV meds. So all of our patients are able to access those same medications from the government. Actually, we're in negotiations right now with the National Health Fund to be able to get access to the non-HIV pill drugs, so the hypertensive, the diabetics. Because what you need to understand is that a person living with HIV has all the other chronic diseases plus HIV.
Not just one. Understood. I think we've gotten enough facts that those who are watching us have a pretty good idea of just the level of support that HCJ can provide. Wonderful. And these last few minutes, I'd love if you could share with us some achievements, just like your top 3.
Top 3 achievements. Okay, so I think that this exponential growth in patient numbers is something that we're really proud of. Our ability to leverage a lot of the IT platforms. So we have what's called an online reservations system. So if you go online to healthconnectja.com, you can actually book a service for yourself. The service provides you with automated reminders. The provider also gets an alert. You get alerts as the patient to remind you, because a lot of times the remembering that your appointment is tomorrow is something that can be a challenge. So being able to leverage a lot of the information technology platforms is something that we're proud of as well. Building a team of 15 people is something that I'm also really proud of. I'm extremely proud of the team. I'm merely one person in the group. And they're the ones that actually do all of the hard work during the day. They're the ones that interact with the clients every day. And I think that their performance has been stellar, and I'm really proud of them.
Awesome. We're just about out of time, and I'd love you to give a final word to those who are watching right now.
So if you're out there and you may have been afraid to find out whether you're positive, you may have known already and you're not ready or willing before to go out and get treatment and help for yourself, please reach out to Health Connect Jamaica. We're standing here, we're ready, we're waiting. We want to support you. We want to see you live your best life. And don't hesitate. Come on board. Health Connect Jamaica is here.
Thank you so much, Doctor. Sure. I'm just going to sneak this one in there. What's the vision for the future?
So Health Connect Jamaica has large visions. So HIV is but one of the disorders. We've already started to take over, well, the Ministry of Health handed over their COVID vaccination outsourcing initiative in the private sector to Health Connect Jamaica. So we're now expanding now to emerging diseases to be able to be the first port of call for anyone who wants private sector expansion at a national scale.
Ah, all right. That you heard the call, you heard the encouragement, and you also hear where Health Connect Jamaica is going. You can get more information about the Ministry of Health and the Health Connect partnership benefiting persons living with HIV and soon many other ailments by visiting healthconnectja.com. This has been Get the Facts. Our guest has been Director of Health Connect Jamaica, Dr. Geoffrey Barrow. Thank you for watching, and until next time, I'm Theodore Henry. Take good care.